question for you.
Yes, your phone has turned off.
Yeah. So, a COVID vaccine had side effects. Does monkeypox vaccine have a side effects?
Yes, it does. I know we're very scared of the COVID vaccine.
Mhm.
We've had big scares, and people
Yeah.
came with heart problems and pericarditis and endocarditis and all kind of complications and
Yes,
clots.
yeah.
Um, Monkeypox vaccine has side effects. Pain at the site of injection. Some people have reported diarrhea or other problems with it. Again, the heart problems are there. The pericarditis, the endocarditis, myocarditis, but the side effects are very low. Now, remember, we are going to offer monkeypox vaccine to people at high risk. If they get monkeypox, the side effects are very high. The effects of the disease are quite nasty. 3 to 10% chance of dying, especially in the highly vulnerable group. So compared to them, the monkeypox vaccine side effects are low. So getting monkeypox is more dangerous. Getting vaccine is less dangerous.
Okay.
As long as it is judicially used, I don't see it being dished out to everyone.
Okay.
The current situation is not of panic, and the pandemic is not that bad that we have to give it out to everyone. But the high risk patients will definitely benefit from it. And yes, the side effects are there. I'm afraid there's side effects of everything. I often,
Yeah.
yes, I often tell my patient, I say, if you drink water, there's risk of choking and dying. And I've seen that happen in A&E. We get patients coming in, and stroke ward, when you're working there, patients with stroke, they take water and goes into the lungs and they get infection and people die of it. So choking and die can happen with drinking water, but you won't stop drinking water
Yeah.
because it's life saving. So
Sure.
everything in life comes with a risk, and you have to take those risks into account. But the risks are not very high. I have to emphasize they are very rare.
Yeah. So the next question is there a treatment for monkeypox?
Yes, we do have a treatment for monkeypox. It's an antiviral drug called tecovirimat. And tecovirimat is a drug which blocks the virus from coming out of the cell. So when the virus enters into a cell, what it does is make many children, multiply, then burst out of the cell and attack other cells. But tecovirimat takes away its capability of bursting out of the cell. So it's trapped in the cell, and when the cell dies, the virus dies. So it is preventive. You can use it in the early stage to prevent the infection from becoming worse. And you can also use it as a treatment. And the drug has been around for some time. It has been approved, studied by FDA. Again, it does have side effects, diarrhea or constipation, nausea and vomiting, the usual antiviral medication side effects, but it's generally well tolerated and very effective.